Let's go through the next stage of labour, which is when you birth your baby. Crowning and birthing are the final stages of labour and childbirth, but you also have to birth your placenta. Now that happens after your baby is born. So crowning happens when your baby's head begins to come through your vagina. This is often the most intense and challenging part of labour for many women. The perineum, the area of skin between your vagina and anus, stretches to accommodate your baby's head as your baby comes out. Crowning is often described as burning or a stinging sensation, and you may experience what is called a ring of fire, which is a very intense burning sensation as your baby's head stretches your vaginal opening. To try and avoid tearing, you want to ease your baby out slowly. Your healthcare provider is going to provide guidance on when to push and when to hold back. First, your baby's head is born, then the rest of the body comes out quite quickly. Your healthcare provider may guide your baby's shoulders out and their body out to ensure a smooth and safe delivery. Once your baby is born, the best place for your baby is on your naked chest for skin-to-skin contact, bonding and establishing breastfeeding if that's how you're planning to feed your baby. The umbilical cord is usually clamped and cut, and the placenta is delivered shortly after your baby is born. Your healthcare provider is then going to check your baby's condition and may perform routine procedures such as drying your baby, clearing the airways, and checking vital signs. This is a big moment of lots of joy and anticipation as your baby is finally born. All medical tests and checks can be done with your baby on your naked chest for skin to skin unless there is an urgent medical reason why your baby needs to be taken away from you. When you are putting together your birth preferences, think about whether you would like delayed cord clamping. So delayed cord clamping is where the umbilical cord is not clamped and cut immediately after your baby is born, but instead it's left intact for at least 1 to 3 minutes or until pulsations in the cord stop. Delayed cord clamping allows more blood from the placenta to transfer across to your baby, increasing your baby's blood volume, which can help prevent anemia in the newborn period. Another thing to think about is whether you would prefer a natural placental delivery, also known as a physiologic or spontaneous placental delivery, which means you birth your placenta without any medical intervention. In this case, after your baby is born, your uterus continues to contract, which helps detach the placenta from the uterine wall. On the other hand, though, a managed placental delivery involves medical interventions to deliver your placenta. So this may include giving you an injection of synthetic oxytocin or pitocin to stimulate uterine contractions and help your placenta detach more quickly. The most important thing to do though after your baby is born is that skin-to-skin contact, where your baby is placed in direct contact with your bare skin on your chest or abdomen. Skin-to-skin contact has so many benefits for both you and your baby. Your body temperature helps regulate your baby's body temperature. That's going to keep them warm and prevent hypothermia. Skin-to-skin contact will also help regulate your baby's heart rate and their breathing rate. Skin-to-skin contact immediately after birth can help with getting breastfeeding started successfully. So the close proximity to the breast encourages your baby to latch on and breastfeed. You can also see amazing videos online of babies doing what is called the breast crawl, and that's where they crawl and seek out the nipple for that first feed. Skin-to-skin contact can also help soothe and calm your baby, reducing stress levels and decreasing crying, and has been associated with improved weight gain and growth in premature and low birth weight infants. Skin-to-skin contact is a simple and effective way to promote the well-being of both you and your baby, and it's recommended as a routine practice in many healthcare settings around the world.